All righty. Well, hello everyone and happy Friday. Hope everyone is having a wonderful day and gearing up for the weekend ahead. All right, so I am here to answer questions you may have related to hyperthyroidism, Graves' disease, hypothyroidism, Hashimoto's. So yeah, it's been a little bit since I've done this just because main reason I'm hosting in October. I'm hosting a thyroid related summit, and you'll get more information as it gets closer. But there's going to be like 30, around 30 people presenting. So I've been doing a lot of interviews. So besides the podcast, doing interviews for the podcast, I've been like for normally for the podcast, I might do 4 to 6 interviews a month. In May, I did 17 interviews like total, so like 3 times as many. So yeah. Anyway, so it's and a lot of people have been choosing like Fridays around this time, which is when I've been doing the Q and A's. So, but yeah, so I don't have one. Actually, I had one at 12, and that person rescheduled because even then it would have been difficult. I could have done one, I guess, maybe 1:30, but for consistency purposes, like to keep it around 1 o'clock when I do these. So let's go ahead and for those who, if you're not familiar with me, want to share some resources. I have a podcast called Save My Thyroid, and you could check out by either visiting savemythyroid.com or you could just visit your favorite podcast platform, whether it be Apple or Spotify or somewhere else, and just type in Save My Thyroid. And so with the episodes, there's a little bit more focus on hyperthyroidism just because there's not really podcasts out there. Most of the podcasts focus on hypothyroidism and Hashimoto. So you'll notice a little bit more focus on hyperthyroidism, but most of the episodes, especially the interviews, will benefit those with either hyperthyroidism or Hashimoto's. And then my website, my main website, so there's savemythyroid.com. That was out in 2021. Just figured it'd be easier to remember than my first website, naturalendocrinesolutions.com. So with the podcast, that's where you could find information on the podcast, savemythyroid.com, naturalendocrinesolutions.com. There's hundreds of articles and blog posts related to hyperthyroidism and Hashimoto's. And if you're not familiar, not aware, I have a supplement line, which you can check out by visiting thyroidsave.com. And then I have some books. I have 3 books related to thyroid health. My first book, Natural Treatment Solutions for years ago, but still most of the information is still relevant. And then my most recent book, The Hyperthyroid Healing Diet, was released in March of this year, 2024. And then as far as announcements, so many of you, I'm sure, have received the email that I'm hosting a 7-day thyroid healing diet boot camp that's going to start on Monday, June 10th. So this is what some of the things it's going to include: daily recorded lessons, daily live calls Monday through Sunday, 2-hour Q&A call on Saturday. There'll be a daily assignment. There's other benefits as well, but these are some of the main ones: engagement with others, prizes for participation. So there is a charge for this. And it is for those with hyperthyroidism or Hashimoto. So whether you have Graves' disease, Hashimoto's, a non-autoimmune thyroid condition, you could benefit from it. Cost is $49. And if you want to register or learn more, you could visit thyroidbootcamp2024.com. All right. So if you have questions, definitely let me know. I'm going to leave this screen up for anyone who trickles in late or if watching the recording. Uh, I guess if you watch the recording, you should see it from the beginning. But anyway, so I guess for those who trickle in late, and yes, and also if you're in one of my Facebook groups, things have changed. I forgot, it was, I think, March or anyway. So I used to be able to live stream directly into the Facebook groups, but Facebook changed that. So they no longer allow that. So this is being live streamed to my Facebook page as well as to my YouTube channel. So let's see what questions people have. Okay, so we have a few questions here. We got Nisa ask, what multivitamins do you recommend for someone with Graves' disease? I had hyperthyroidism, but then when I took medication, methimazole became hypothyroidism. I'm so confused. Please advise. I mean, some people will say low iodine supplement, but I'm not too concerned about an iodine in a multivitamin. So I just wanted to say that because my choice, one of the vitamins I like, the multis, is from Designs for Health. They have either a twice daily multi or a complete multivitamin. And again, they're not iodine free, but pretty much most people that I work with do fine with that. Usually it's uh, like higher amounts of iodine. Taking separate iodine supplements causes problems for some people, but some people it doesn't. But anyway, that's typically what I recommend to my patients is the Designs for Health twice daily multi or the complete multivitamin. All right. So Mel, how you doing, Mel? If we want to work with you for Graves but live in Canada, is it possible to get all the testing you need if our medical doctor won't be on board? I mean, maybe. I mean, all the important testing, yeah. Like there are blood tests that people in other countries, even the United States, I mean, if someone's paying out, I mean, if someone's trying to run everything through health insurance, they might not get everything covered. I mean, the and they usually won't. Like again, so even in the United States, like if I recommend blood testing, even that won't always be covered. They might have to pay out of pocket. Same thing with like specialty tests, like saliva testing. So, I mean, the answer is yes, but you might need to either go somewhere else, or again, we could send tests too. Like we could send like blood testing. We obviously can't. That you would have to get locally, but other types of tests, whether it's again a saliva test or if you need a stool test, I mean, those we could most places like Canada and Europe and even some other places overseas internationally. So usually it's not a problem. I would say contact. Do you have any further questions? You could reach out to my staff person, Kate. Her email is staff at naturalendocrinesolutions.com. Okay, and then you know what? I haven't been sharing. I haven't been sharing the. It's been that's how long it's been. So this is the multivitamin question here. um, and then this is from Mel. What's so yeah, that's it's yeah. I guess it's been a while. That's I've been doing all my interviews. I've been doing on Streamyard, and then with Streamyard, there's no comments, so it's just me and the person doing the interview. So so again, I've been out of the routine of sharing comments. So all right. So yes, want to learn more about hyperthyroidism. Yeah. So again, plenty of resources. So I could again, if anybody trickled in late besides the this announcement, these are the resources over here. And again, a lot of information on the podcast with hyperthyroidism. And again, the Hashimoto's, a lot of people benefit from that. But then I have two books on hyperthyroidism that you can find on Amazon. And then, yeah, if you want to learn more about diet in relation to either hyperthyroidism, Hashimoto's, and there's a recent boot camp. And Carmela is subclinical hyperthyroid, high T3. TSH is fine, but T3 is a little, TSH and T4 is fine, but T3 is a little bit high. So yeah, yeah. I don't know if you tested antibodies just to make sure you don't have subclinical Graves, but if you assuming you don't have Graves and it's just non-autoimmune, um, again, I talk a little in my recent book, the Hyperthyroid Healing Diet. I talk a little bit about subclinical hyperthyroidism, just doing things to improve adrenal health, heal the gut. I mean, there is definitely overlap between subclinical hyperthyroidism and Graves, but it's different because Graves is autoimmune. And but and I do have some articles and podcast episodes talk about subclinical hyperthyroidism as well. Okay, we got Mayrose. Hello from the Sunshine State. I've been exploring liver detox. I saw on your web that you have hepatoimmune. I believe what's that? Yeah, the hepatoimmune supreme. Does it actively detox liver? What about other organs? It's mainly like the liver does also has some things like burdock root that could also help with the kidneys. If you're looking for like a full body detox, there is also on my website. It's not my product I'm about to discuss, but I do have a homeopathic detox, and kind of herbal homeopathic from Desbio called their Omni Cleanse, and that is like considered to be like a whole body detox, uh, detoxing not only liver but kidneys and lymphatics, even cerebral spinal fluid, and so that's like it's an 8 week detox. So it's more of like a detox program, not just like a single supplement. So it's Omni Cleanse. So if you do a search, OM as in Mary, N as in Nancy, OMNI cleanse. And yeah, the only thing I will say about that is you have to have an account to like see the product. So, and that's not our rules, that's the company does bio. So yeah, so so if you're looking for more like just more like a whole body. I mean, the Hepatoimmune Supreme is really good too, but if you're looking for something like a more of a program and a whole body, I would look into um, yeah, the one from Desbio, the OmniCleanse. So Carmela, I've been taking Thyrosoothe. Have you heard of this? It seems to be helping my higher heart rate, which scares me the most. Yeah, Thyrosoothe. There's Thyrosoothe, there's thyroid calming formula, which has the bugleweed, the motherwort, the lemon balm in there. And yeah, I mean, you might be well, your T3 you said was a little bit high. So yeah. So yeah, no, that's Thyrosoothe. Uh it's not the most potent form, but in your case, being that you're subclinical, you might not need the most potent form of like the more potent herbs out there. Yeah, I when I dealt with Graves, I took what was called from Mediherb bugleweed, and motherwort, which they're 1 to 2 extracts ratios, which is more potent than like usually what's out there, which is like 1 to 4, 1 to 5. But again, not everybody needs that. So, Nanette, I've been taking PTU for my hypernodule for about 3 years. I'd love to get off methimazole, make me shaky. I'm hoping your thyroid diet will get me off the meds. I mean, again, I definitely would follow the recommendations that I give, whether it's the thyroid boot camp, that I'm having, thyroid healing diet boot camp, or again, reading my book. I mean, again, everybody's different. So sometimes you have to go beyond diet. It's not always just about the diet. So diet's important, but for some people, it's a starting point. And even in both the book and this boot camp, I go beyond the diet. I mean, the hyperthyroid healing diet book, there's a whole section going beyond the diet. And with the boot camp, there's 7 lessons, and one of the lessons goes beyond eating a healthy diet. So again, so it might help just the diet alone, but I wouldn't give up if you follow the diet for a while. And if you're not able to get off again, you might need to do more than that. So, and some people, there are other things out there, like some people, for especially if they have like a hyper functioning nodule, if doing things to shrink the nodule and address the cause of the problem is not helping, there's things like RFA, radio frequency ablation, which is not the same as radioactive iodine. Some people get the two confused. Radioactive iodine, I definitely don't recommend, but radio frequency ablation targets the specific thyroid nodule. So 3 daily vision, hyperthyroid and struggling with thyroid eye disease. Do you have any suggestions on how to reverse the attack on the eyes and reduce swelling and bulging? Castor oil helps me with double vision and dryness. I mean, that's great about the castor oil. I mean, it does come down to finding and removing triggers. I mean, thyroid eye disease is autoimmune, just like Graves' disease. And so while you could take things like selenium could help, having healthy vitamin D levels can help. I do have a product, SMT Berbera, which is berberine and alpha lipoic acid, which can help in some cases. But what's causing the autoimmune response? Is it a certain food? Is it do you have some type of infection? Do you have a chemical? I mean, everybody has a chemical exposure, but finding, removing the triggers, healing the gut is extremely important. Not only with Graves' disease and Hashimoto's, but with thyroid eye disease, which is again also autoimmune. And again, I have episodes on my podcast where I talk about thyroid eye disease, also on my website, naturalendocrinesolutions.com. So Bonita says, thank you, doctor. I've been hyper since June of 2023 with Graves and thyroid eye disease. I always managed my weight well, and only now, suddenly a year later, I am putting on a ton of weight and can't lose it. Is it possible it's caused by my estradiol being extremely high? My T4 is still high, and my antibodies are not going down. It could be. I mean, with hyperthyroidism, even though weight loss is more classic, some people do gain weight. So there could be a few different factors. One, I mean, yeah, it could be. So estrogen dominance, problems with estrogen metabolism, yes. Cortisol, adrenal imbalances, especially high cortisol, can make it difficult to lose weight. Microbiome disruption also could play a role. Just even widespread inflammation could play a big role in making it difficult to lose weight. If you're, I don't know if you're taking antithyroid medication, but obviously if someone's taking antithyroid medication such as methimazole or PTU, then that can make it challenging. But even if someone's not on the antithyroid medication and gaining weight, then again, these other factors I mentioned, which again, I also have episodes for this on my podcast as well as on my website. And Bonita also mentions that she did cheat with gluten and chocolate over Easter, and the weight gain and hormone balance has been since then. I mean, gluten could be a big factor. So, gluten, not everybody has a problem with gluten as far as the sensitivity, but a lot of people do, and it could increase permeability in those even who are not sensitive to gluten. So, cause a leaky gut in those who are even those who are not sensitive. So, yeah, gluten, again, it can cause inflammation, which by itself, like I said, could make it difficult to lose weight. So, and it could take time once you've been exposed to gluten. I mean, I'm not so sure about the chocolate. I have to think more. The gluten is probably more of a concern. But yeah, all you could do is try to be gluten free from this point on, move forward. Again, there could be other factors. Insulin resistance that I mentioned as far as weight gain is another thing, another potential factor. Okay, so Nanette says, do you suggest trying to keep your thyroid over getting it removed? Toxic multinodular goiter. Thanks. I mean, I do. Yeah. I mean, if at all possible, you want to try to avoid surgery, radioactive iodine. I mean, that's why my podcast is named Save My Thyroid. And so toxic multinodular goiter, I do speak about that on the podcast and in my books, especially the more recent one, hyperthyroid. Well, actually, both of them, hyperthyroid healing diet and natural treatment solutions for hyperthyroidism and Graves. So just trying to do things to address the cause of the problem. So yeah, I'm not saying there's never a time and place for surgery, but it should be a last resort after everything else has been tried. So yeah. All right, and okay, so May Rose. So my T4 feels a little elevated. My TSH 0.007. All antibodies are negative for Graves and Hashimoto's. I do have nodules. Is this considered autoimmune? I'm on metoprolol, which is a beta blocker. Is CoQ10 best to help manage blood pressure or any other natural recommendations? Yeah, I mean, I can't specifically give recommendations to non-patients, but I could say that beta blockers deplete CoQ10. So like if someone's on a beta blocker, like a patient of mine, I definitely will recommend like for them to take CoQ10. I mean, there's other things for blood pressure like aged garlic. There's a brand Kyolic, Kyolic, I believe. But taking aged garlic can help with blood pressure. Um, but yeah, you're like if all antibodies are negative, so there's three main antibodies. There's a TSI, thyroid stimulating immunoglobulins, which is associated with Graves, TPO, or thyroid peroxidase antibodies, and then thyroid globulin antibodies. So if all three are negative, then that would not be autoimmune. So just because you have nodules, I mean, a lot of people have nodules, so it would appear that it's not autoimmune. But again, you're on the beta blocker because the free T4 is a little bit high because you're pretty much hyper with the low TSH, a little bit mildly high free T4. Um, and then yeah, the like I said, the CoQ10, I don't know if it would be like the best for the blood pressure, but like I said, for the beta blocker, depleting CoQ10. But like I said, the aged garlic also could be helpful in some cases of high blood pressure. All right, so wide awake and aware 22. Hey doctor, I have hyperthyroidism and Graves and sometimes get TED and I have a goiter. I have been taking potassium iodide for goiter reduction 2 weeks ago and goiter going down. Very happy here. Um, and then when my endocrinologist sees me, he will be surprised because he wants to remove it. Yeah, it's controversial. I actually have had good experience in the past with potassium iodide, which is what the KI stands for. Um, for those who are not familiar with that, but yeah, I mean, some people it definitely can make things worse. So I would, in most cases, I'm going to say work with a healthcare practitioner, just because there are people that take high dose iodine and things get worse. But you're probably taking the proper precautions, doing things like selenium and some other things to minimize negative effects. But yeah, that's great. That's great about it helping with the goiter. I mean, other things like problems, insulin resistance could affect nodules and a goiter. Estrogen metabolism problems can affect the goiter, the nodule, just inflammation in general. But yeah, iodine deficiency in some cases could also be a factor. So I'm glad that's helping. So Nada says my TSH is zero point 0.1, but T3 and T4 are normal and my neck is enlarged. I am on AIP level 3. Okay, so sounds like you read my book. So thank you for reading the hyperthyroid healing diet. So I'm on level 3 for 2 months and feel good, but recent results for TSH didn't change. Any suggestions? So um, I don't know what I guess the T3 and T4 was that what did those change? Because TSH can take a while to change. I actually have a podcast episode on TSH, which is more of a pituitary hormone. It's not a thyroid hormone, but I have an episode on how long does it take for the TSH to increase. And the reason I have that episode is because it could take a while, and so it's a common question. So it and also keep in mind this too. So I mentioned this earlier. Many times, diet's important, but again, many times we have to go beyond the diet, and that's why in my book, Hyperthyroid Healing Diet, it's I have that whole section going beyond the diet because you want to start with the diet and lifestyle and see what changes that causes. But again, for many people, it's not enough. It's a piece of the puzzle, but many people just doing that isn't sufficient. So again, in your case, if T3 and T4 were higher and they decreased, then that's a good sign, even if TSH hasn't increased. So as long as T3, T4 continue to decrease, in most cases, eventually TSH will increase. It could take a good amount of time for that to happen. But if T3 and T4 have not decreased, then it would make me think, well, maybe there's something else beyond the diet. So again, it doesn't mean that you aren't getting any benefits from following AIP, but just means that you might need to dig deeper again if that T3 and T4 haven't improved. All right, I'm going to take a quick sip of water here. All right, so 3 daily vision. Thanks. In your opinion, how often do the eyes return to normal with the right natural approach? Depends on the severity of thyroid eye disease. If someone has severe thyroid eye disease, it might not go back. I would say like when someone has really severe thyroid eye disease, it might only be like a 10-15% chance of it going back like completely to normal. If someone it's more mild to moderate, definitely a greater chance. um, especially if it's mild. When it's moderate, it depends on the person, finding, removing the triggers, and again, really the severity of, the bulging, for example. Um, I know Tepezza, I'm not recommending Tepezza because side effects are common, but Tepezza came out in 2000 is, no, I'm sorry, 2020, not 2000, has been out that long. So for about 4 years, little over 4 years, 2020. And I know that some people have had dramatic, like improvement in the eye bulging, even severe with Tepezza. The problem is that side effects are common, including like tinnitus, hearing loss. So yeah, I'd be cautious. I mean, there's a, yeah, hard to say. Is there a time and place? Because it's a lot of times choosing between that and surgery for like some severe cases of thyroid eye disease. But with surgery, it comes with its own set of risks. So it's possible, but again, if it's more of a severe case, then getting complete resolution would getting it back to where it was prior to the thyroid eye disease might not happen. So improvement is definitely possible, but how much really depends on the person and again the severity. So Cheryl says, "Can you suggest anything to reduce a goiter? I'm taking my medication daily. I just can't get the swelling down." Yeah, I know someone before mentioned the potassium iodide, which is controversial. That could work in some cases, but it could also backfire. So with goiter, I mean, doing things to reduce inflammation, so eating an anti-inflammatory diet definitely is important. Just really incorporating the basics, the diet and lifestyle factors, but you might need to do more than that. So insulin resistance, which if you're not sure if you have, you can look at the hemoglobin A1C, look at fasting insulin. Those could be factors with a goiter. Problems with estrogen metabolism, which really the only test that looks at that would be a dried urine test, like the Dutch test. Not saying you have to do all this. I mean, the blood sugar markers, pretty easy to do. The Dutch test, uh, just a little bit pricey, but I think it's a great test. But those are some of the factors that can cause a goiter, and just again, inflammation in general. But the question is, what's causing inflammation? And that's where looking at the triggers, the food, the stress, the chemicals, infections, healing the gut, things that could help with inflammation. But again, sometimes it is a challenge finding the source of the inflammation. All right, so Nanette, you are very welcome. So Lindsay says, 6 weeks ago, my TSH was 0.02. So my doctor decreased my Synthroid from 125 micrograms to 100 micrograms. Now my TSH is 0.01. So he decreased my Synthroid to 50 micrograms. Is this too much of a decrease? I'm also on 10 milligrams of Cytomel. He just ordered a full thyroid panel. I think he's thinking Graves now. I mean, did you look? Yeah. Okay. So I was about to ask, did he do like T3, T4? But you said yeah. He probably, yeah. Might be Graves. I mean, might be hyperthyroidism. I guess you'll have to see what you have to see what it looks like. And that's the answer to your question. Is that too much of a decrease? I mean, if you have Graves' disease, then no. If you have Graves' disease, you might be off of the Synthroid before you know it. Again, not by my recommendations, but by the prescribing doctor's recommendation. But if you don't have hyperthyroidism, if it's just that, you know, again, if you have Hashimoto's and your immune system is improving and you need less thyroid hormone, yeah, I would agree. In many cases, 120 going from 125 to 50 is a big decrease. I could understand wanting to decrease, being that the TSH didn't really budge, but I think it's good what your doctor's doing. Ordering the full thyroid panel, because again, if you're hyper, if you have Graves, then chances are I'll probably take you off of the Synthroid and the Cytomel. So, I mean, in some cases, we don't see it a lot in the United States. There is what's called block and replace therapy, where for hyperthyroidism graves, they might put someone on both antithyroid medication and something like synthroids or another type of thyroid hormone replacements. And this way, the problem is when someone has graves and they're on just the antithyroid medication like methimazole, a lot of times they'll become hypo and they might reduce the dose, and the person maybe will be okay on the reduced dose, but maybe they'll become hypo again. So sometimes they'll do the block and replace therapy. But yeah, you'll just have to see what the thyroid panel looks like. You just ordered it, so definitely get that blood draw as soon as you can. Hopefully, get results maybe as soon as next week, and see, if it's if you do need to, if he is, he or she will recommend, or you said it's a he just ordered full thyroid, so a male doctor. So so again, if you're hyper, he will probably tell you to stop it, especially if it's Graves. Um, I mean, again, if someone's hyper because they're taking too high of a dose of the meds, then they'll reduce it. And like I said, that might be a really big, like too much of a reduction if it's hyper due to the medication. But you'll just have to see what the thyroid panel looks like, and hopefully also looked at antibodies, like he's suspecting Graves. So hopefully he's not just doing the T3 and T4, but looking at the antibodies, especially the thyroid stimulating immunoglobulins as well as the TPO antibodies, even the thyroid globulin antibodies. Okay, and for the recommending try eating more meat and protein. Yeah, it depends on this. Yeah, I mean, different. Could definitely recommend eating more for everybody. Make sure you're getting enough protein. So Lindsay, my T4 is 11.9. So I assume that's the total T4. There's total T4 and free T4. So I assume that's the total T4. If you're in, it depends where you are. Also, the United States or like overseas, they might, for the free T4 they use different units of measurement. But yeah, I'm thinking you're in the United States and that your total T4 is 11.9, which is on the higher side. But yeah, it'd be nice to see like the free T4, the free T3. Look at the antibodies, and then yes, selenium, calcium, magnesium, glycinates. Um, okay, so you're doing that with the potassium iodide. Okay. Okay, so Cheryl, so how do you use the iodine? I mean, you could ask this question, maybe Wide Awake will answer. I mean, when I took, again, because I'm not giving recommendations to take iodine, because in some people that they don't do well. Again, now you don't put it on your skin. That's not typically, you are ingesting it. Usually people ingest it either taking like tablets or could be capsules, but a lot of times tablets or liquid like Lugo solution is how they're ingest. And then, as Wide Awake mentioned, you want to take if you choose to take it. Again, I'm not recommending to take it because it could sometimes make things worse. But selenium, things like magnesium, not sure really if calcium for this purpose is necessary, but the selenium, magnesium, some will take vitamin C. Okay, my family doctor won't refer me to a thyroid specialist. Yeah, well, I guess if they're doing the full thyroid panel, I guess we'll see what that shows. And yeah, I mean, yeah, if you have Graves, you probably should. I mean, really, it's up to you. I was gonna say you probably should be referred, but it depends on the approach you're taking. Like when I dealt with Graves, I saw an endocrinologist one time. I saw her just to get the diagnosis, and of course, I didn't have the knowledge I had then. That I didn't have the knowledge now that I had, or back then I didn't have the knowledge that I have now. So I went there to get diagnosed, but I didn't take the antithyroid medication, and really there was no need for me to see her if I wasn't following her recommendations. So if you're following the recommendations of your, like if you play, like if you don't plan on following the endocrinologist recommendations, then there's no need really to go to one if your primary care doctor is going to do the diagnostic testing. But if you need, let's say, antithyroid medication, now maybe your primary care doctor will prescribe it, but a lot of them won't. A lot of them, my guess is if you're, and I could be wrong, but if you're diagnosed with Graves, they're probably going to want to refer you. Usually, most primary care doctors don't want to manage Graves' disease, but I guess we'll see what your numbers look like. Okay, I'm gonna go until 2 o'clock, assuming there's enough questions to last until then. Then I'm gonna sign off. I do have a podcast interview this afternoon, so But May Rose says, "Do you think there's a role in chiropractic care to manage hyperthyroidism, blood pressure, stress, inflammation, or to help stabilize my T4, TSH levels?" I mean, I'm a chiropractor. I mean, I don't really practice chiropractic like I did years ago, but I'm still a licensed chiropractor. So I definitely believe in chiropractic, but in most cases, chiropractic's not going to like play a big role in managing the hyperthyroidism. I mean, if you go to a chiropractor, especially like someone who that's all they do is chiropractic, even maybe some who do chiropractic functional medicine, they might say, yeah, because the nervous system controls everything in the body, including the thyroid. So if you have problems in the spine, that's leading to the nerves. That's innervating the thyroid gland, and that can cause a thyroid condition, which is true. I'm not going to deny that, but in most cases, going to a chiropractor again, I think it's good for just overall health and um, just going on a wellness basis. Definitely in favor. I'm definitely in favor of chiropractic, but for this purpose, it's probably not going to help greatly. But I mean, when I did adjust patients regularly, I would see some amazing results even that I wouldn't expect, like people with allergies where the allergies went away, and that's not what I was trying to do. I mean, I was just trying to balance the body, and the body really took over. So you never know. I mean, it's not going to hurt for to see a chiropractor. Some people have the same question with acupuncture. So yeah, I mean, if anything, those can help, but for many, it won't be the missing piece of the puzzle. So, Bonita, how would you increase the body's methylation? So, I mean, methylation is phase two detoxification. B vitamins, really good. So, B12, folate, even B6 are really good for improving methylation. And yeah, I have some of you might be familiar with MTHFR. So I have homozygous MTHFR genetic variation, and also elevated homocysteine levels, which those two combined usually means that there's a methylation problem. So I take a supplement called Methyl Protect to because there are genetic factors. So if I stop taking that methylation supplement, the homocysteine increases. And there's nothing I could do about the MTHFR um, genetic polymorphism. Once you have it, you have it. So, and how would you best heal leaky gut? Sorry, I don't have it. I'm in South Africa. I will import it soon. Um, Yeah, I'm not sure what you mean, like what you'll import, but I mean, there's again episodes on the podcast, but I talk about like the 5R protocol where you want to remove the factor that's causing a leaky gut, replace things like digestive enzymes and sometimes like stomach acid that's low, reinoculate with prebiotics, probiotics, repair the gut with things like bone broth or cabbage juice or taking like gut healing supplements, and then rebalance. So stress management, getting proper sleep, sometimes doing vagus nerve exercises such as humming and singing out loud and vigorous gargling. So yeah, that's a short answer. Again, if you want more information, definitely check out my podcast, savemythyroid.com, as well as my main website, naturalendocrinesolutions.com. So Anna, so in an ideal state, should we be aiming to get antibodies down to zero? I mean, It depends on the antibodies. I mean, for some, like in the United States, LabCorp and Quest Diagnostics are the two most common labs in the United States. And thyroglobulin antibodies, which is more closely associated with Hashimoto's, their range is like less than one, which means it ideally should be zero. But like something like for Graves, thyroid stimulating immunoglobulins, it depends on the lab, but and because there's also different units. Some will use a percentage. Um, but for those who don't use, well, for those who use a percentage, usually the percentage is less than 120. And then the other range would be like less than 0.55, right? Yeah, 0.55, 0.55. So I usually don't expect to see it zero. And there in the literature, it does say that some autoantibodies are normal, part of like the cleanup process. And so I don't want to see it on the higher side of normal. So if like we're aiming for less than 0.55, for example, I like to see it like zero point 0.3 or below. If it's like 0.49, that's kind of on the higher end, for example. And there's also thyroid peroxidase or TPO antibodies. So same thing. I like to see them on the lower side of the reference range, not on the higher side, and obviously not elevated. So Benita, sorry I don't have your book. I'm in South Africa. Okay, so my book. How would you heal the leaky gut? Okay, yep, and I already answered that. I'll also say one more thing about the leaky gut. Out of the 5-hour protocol, the remove factor is arguably the most important because if you don't remove whatever factor is causing a leaky gut, whether it's gluten, whether it's an infection, then it will really be difficult, if not impossible, to heal the gut. So Lindsay, I also take CBD oil. Can that affect my thyroid hormone levels? I mean, I don't think directly it could because the CBD though does help with inflammation. So if it's lowering inflammation and again, Graves, Hashimoto's are autoimmune conditions, and by calming down the immune system, it might positively affect the thyroid hormone levels, or you might need less thyroid hormone, in your case, thyroid hormone replacement. So um, but yeah, as far as I know, CBD oil does not directly affect the thyroid gland. Okay, and Nada, you are welcome. Oh, Paola, hello. I pretty much fixed my graves now. Wonderful. Well, thank you. Thanks for popping in and giving that update. So hope you're doing good. And yeah, a lot of people on YouTube. So again, maybe this for the Facebook thing where I can't do live streaming into the Facebook group is a good thing because I wasn't live streaming to YouTube previously. It was just my two Facebook groups and Facebook page. But now I've been doing it to my YouTube, and we have a good amount of questions coming in from YouTube. We do have some on the Facebook page. Oh, and you have more. My endocrinologist was terrible, so you probably can do just fine with your PCP. Yeah, it depends. I mean, I would agree. I mean, if the PCP is going to manage it, like a lot of them just don't want to manage it and don't want to recommend the methimazole or antithyroid medication. Um, but yeah, I mean, you are right that a lot of endocrinologists are not nice and they're just have a big ego. Again, not all of them. I've had some nice endocrinologists. Dr. Angela Mazza, an integrative endocrinologist, has been on my podcast a few times. I just interviewed another one who the interview probably won't go live until July, but there are some nice ones out there, but a lot of them are not nice. So, PJ, I have Graves and I'm in remission following your protocol since 2018. Wonderful. Thank you. Thanks for letting us know. However, my blood tests are still normal, but I have symptoms from time to time, such as my eyes bulging a little bit. And my friends who is in the health profession didn't believe it could be my thyroid that's causing the hyperthyroid symptoms since my blood tests were normal, but I know I'm having the symptoms. I guess, I mean, it depends. If they're on the higher side, it could, but there are other factors that can cause increased hyper like tachycardia, for example, increased resting heart rate is commonly associated with hyperthyroidism, but there are other factors like having a histamine intolerance, which I'll talk about histamine in the boot camp that's taking place next week. So it could be something else. If your TSH is looking really good, like let's say it's over 1 and your thyroid hormone levels are within the lab range, then yeah, you're not hyper. And I would probably agree it's probably coming from something else. Now, the eyes, like you mentioned, um, your eyes bulging. So that to me would indicate you still have and like some active autoimmunity going on because again thyroid eye disease is more of an immune system condition. So I don't know if you've tested the TSI, thyroid stimulating immunoglobulins, lately, but if not, that's something I would consider doing. So Bonita, what's your thoughts on the best peptides for someone with Graves now after the peptide summit? Oh boy, you're testing my memory, which again, I'm still learning about peptides. I mean, the BPC 157 for the gut, it seems like it's a really good peptide because when, I've had Jen Flagar on the podcast, and she's also going to be on the summit that I'm having in October. So I interviewed her actually twice. So you won't be able to see the second one until October, but um, the BPC one, like she was talking about I think she mentioned this on the one that's on the podcast, but like how some of the oral peptides are not as effective as the injectables, but now there's new regulations and rules, so not every practitioner could give the injectables, and that would like include myself. But BPC 157 seems to be really good in oral form to support the gut. There's like the thymosin alpha, which again, that no longer is allowed, or again, that's just like certain practitioners and it's injectable. So there's another one I'm blanking out. I forgot. I actually have, let's see, I have a handout here. The company that Dr. Jen Flagar uses, Healthgevity. So I actually just recently signed up for them. So there is so the thymosin B4 frag is also another one. I think she spoke about that. So the BPC 157 is really good. The thymosin B4 frag, for those for like thyroid autoimmune. There's another one she mentioned, Pepti Strong, which they have a product longevity. So I'm going to check that out and see if I notice the difference from a muscle mass perspective, which also is a factor with people with Graves. But it's again, they're expensive, so I don't. I would stick with, if someone's going to take peptides, the BPC 157, and then again maybe the, as I mentioned, the thymosin B4 frag is the other one. But like I said, I'm still learning. So Carolyn, I've had Hashimoto's for several years, began taking Lugol's 2%. Within 4 months, I developed Graves. Could it have come from the iodine? It's possible. I mean, again, iodine, definitely controversial in the worlds of thyroid health, but it could do wonders at times, but it could also be a trigger for, actually, it could be a trigger for Graves or Hashimoto's. So even though again, I had my experience with Lugol's with iodine, potassium iodine in the past has been positive, but everybody's different. So it is possible. It's hard to know because there could be other things. Other There could have been other factors too, but if you, everybody's different when it comes to iodine. Some people will cause a good amount of oxidative stress, even if you're taking things like selenium and vitamin C. And so if you're getting more oxidative stress than you have antioxidants, that could kind of like be the straw that broke the camel's back, and be at least a contributing factor when it comes to Graves. All right, we're going to go another 10 minutes. So Paola says, I have to say that the chiropractic adjustments actually helped me with my Graves. Graves gave a lot of neck pain, and him adjusting my neck really seemed to help. Yeah, I would agree. If you have any type of neck pain or back pain, or, I mean, Yeah, I mean, chiropractic is more about just neck and back pain, but I agree in that, like in those situations. And as I said, I mean, I'm definitely an advocate of chiropractic since I'm a chiropractor. So I think just from an overall health perspective, people could benefit from going to a chiropractor just for the purpose. Like the person who asked the question earlier was like kind of asking, can seeing a chiropractor like help lower the T3, T4 levels? And yeah, I've not seen that. Again, I don't tell people that that's not the recommendations I give. Okay, let's go to a chiropractor and see if that helps. Usually we're doing other things, whether it's the anti-thyroid medication or something like bugleweed. And if they go to a chiropractor, maybe it is a piece of the puzzle helping, but it's hard to know because we're doing other things as well. I wouldn't, like if someone's seeing a chiropractor, that's usually not all. If they're working with me, they're not just seeing a chiropractor, because if they were just seeing a chiropractor, they wouldn't be seeing me. But if they're seeing me, then they're doing other things as well. All right. So Baggy says, has Hashimoto's, and I hope I pronounced your name right. I apologize for anyone if I didn't. But Hashimoto's TSH really suppressed, low border, free T3, T4 and upper range, no hyper symptoms on levothyroxine, meds up due to T3 falling below minimum. How to safely reduce meds, increase T3. Yeah, so I can't tell you like to reduce the meds. Again, yeah, for yeah, but you're I mean, keep in mind T4, and you might already know this, but T4 needs to convert into T3. So, and if you're taking levothyroxine, that's synthetic T4. So your free T3 is low, your T4 is in the upper range. Giving you more T4 typically is not going to be the answer because it's more of a conversion problem. So the goal would be to try to do things to help with the conversion of T4 to T3. And most of the T4, T3 conversion takes place in the liver and the gut. So focusing on those areas. Now, again, thyroid hormone might still be necessary while trying to do that, while trying to address the cause of the problem. Uh, Again, is levothyroxine the best option? I mean, probably not. Again, in this situation too. I mean, some would say take desiccated thyroid, like T4, like Armor or NP thyroid. The problem with that is the ratio is going to be the same, so it might increase the T3, but also might increase the T4, which you don't need that. So then there's Cytomel, which is a brand of synthetic T3. So some would say, again and again, these are not fixing the cause of the problem, but some people might need that. There's also compounded thyroid hormone where you could get T4, T3, and have that in like different ratios depending on, like what your numbers look like. So again, increasing T3, helping with that conversion of T4 to T3 by focusing especially on the liver and the gut. In some cases, maybe asking a prescribing doctor, can I switch to like compounds of thyroid hormone, or again, maybe Cytomel in your case. Again, some would say don't do that because it's not addressing the cause of the problem, which I agree. I agree with that. But sometimes if thyroid hormone gets really low, we need to do it on a temporary basis. But yeah, so hopefully that helps. And Paola, you are welcome, and I'm glad you're doing great. Okay, so I don't know if I could get to everybody. I mean, I got to everybody, or not everybody, but I'm gonna skip over some people I've already gotten to because there's a few people I didn't get to. And then if I have time, I will get to others. But um so right now there's two people I haven't gotten to. So Valasi, I am 11 months postpartum and was recently diagnosed with hyperthyroidism and currently breastfeeding. The doctor wants to start me on 5 milligrams of methimazole. Could there be a misdiagnosis? Are there other tests that you would recommend? Here are my numbers. The free T3, 9.21, free T4, 3.86, TSH less than 0.010, TSI 2.78, thyroid peroxidase 336.50. Yeah, I mean, based on the numbers that, like in the United States, if you're in the United States, those numbers are diagnostic of Graves. Um, I mean, you're definitely hyper. I mean, so TSI, I mean, TSH low and T3, free T3, free T4 high, according to at least the units in the United States. If it was overseas, that might be a different story. But then TSI, usually you want to see that less than 0.55. So not only do you have hyperthyroidism, but looks like you have Graves, and thyroid peroxidase antibodies, also pretty common. Both Graves and Hashimoto's, but so it does not look like it's a misdiagnosis. It does. I mean, so are there any other tests I would recommend? I mean, for diagnosing, no, because again, this is seems like a pretty clear cut case of hyperthyroidism. Again, Graves' disease. But yeah, I mean, I definitely recommend other things to adjust to like find out other imbalances like CBC with differential, a comprehensive metabolic panel, iron panel, vitamin D, for example, as far as blood tests, vitamin B12, lipid panel, CRP, homocysteine. So I definitely like to look at the blood tests and then look at adrenals either through saliva testing or dried urine testing. Um, some cases doing a comprehensive stool test. I also do hair testing, hair mineral analysis, which is a little bit controversial, but I also look at blood testing for minerals like RBC magnesium. I mentioned iron. So yeah, you might want to work with a functional medicine practitioner. I mean, the good news is you're on a low dose of 5 milligrams. I mean, the bad news, it might not be enough to get the numbers where they need to be, but the only way to know is to stay on the 5 milligrams as it was prescribed and do another retest in in like let's say 4 to 6 weeks and see how much that improves. And if it doesn't improve, they might increase the dose of the methimazole. All right. So Pat says, Dr. Eric, you had someone on months ago who spoke of light therapy for thyroid nodules. What are your thoughts? Not sure. I know Kirk Gare spoke about cold laser therapy. Um, yeah, I mean, I don't know. I don't know for light therapy. I mean, I have a red light unit, so I like light therapy. But as far as specifically for nodules, I forgot who that was who spoke about light therapy. So I don't know how much I mean, it's not if someone's using red light therapy appropriately, then it's low risk. But again, for it just using the red light therapy alone to help with thyroid nodules, again, I don't know really any evidence as far. I mean, not that it's surprising in the research. I wouldn't expect to see evidence in the research, but even um, just out there. Like I don't see, like castor oil packs is another one that at least there seems to be like some people who like claim that it helps out a lot. Nothing in the research, and again, you can't always go by research. But like I said, I think low risk, but potentially low. I mean, you could have high reward, but I wouldn't get your hopes up too much. And if I'm wrong, definitely come back and tell me that you used it and it helped with your nodules. The thing is also when someone's doing something like that, they're usually not just doing that. They're doing things to clean up their diet and reduce inflammation and doing other things. So sometimes it's hard to know, is it just a red light therapy? I mean, if that's all you do over the next few months, like if you don't change anything else but stay with red light therapy, and have a dramatic reduction in your nodules, definitely come back here and let me know because I will be doing more of these in the future. All right. And you are welcome. Alisai, again, if I pronounce your name, I apologize. And May Rose, I'm reading a book. Thank you. It's been a wealth of information. You mentioned hydrolyzed beef over pea protein isolate. Is that because of the potential of inflammation? Yeah, ionic foot baths. I don't really. Again, I'm interviewed Wednesday. Well, first of all, with the yeah, I mean hydrolyzed beef. Again, it's more like it's paleo and AIP friendly. So again, friendly level 3, level 2 diet friendly. Pea protein isolate is more controversial, I think, and many people do fine with it though. But and also the effects on the gut potentially. But I think again, most people do okay with pea protein. You also mentioned about ionic foot baths, which again, I don't remember bring up in the book. I did have Wendy Myers on the podcast who spoke about that. I don't have a lot of experience with ionic foot baths. I do oil pulling for for like the teeth and gums. I do that with coconut oil a few times a week, so I'm definitely a proponent for that. Um, and Bonita, I'm on 5 milligrams of methimazole. Would you even take it? My levels are still high and I have a goiter, but I don't want to take too much. I mean, again, I took bugleweed instead of the methimazole. And for some people, bugleweed works well. For other people, it doesn't work well. And yeah, but again, 5 milligrams for some people, I mean, it's a low dose of methimazole. So I understand people not wanting to take more, but for some people, it might be necessary or to switch to something like bugleweed or L-carnitine. All right, so I'm going to wrap things up. Bonita, thank you for your time, doctor. It is appreciated a lot. And just Paola gave feedback to Baggy here. And all right, all right. Well, thank you, everyone. Thanks for tuning in. I think I got to I mean, maybe all the questions, at least most of them, and I think I got to everybody at least once. So thank you. I'm not sure when I'll do the next one. Again, I know. Well, next week I have the boot camp, so I probably won't be doing one next week, and then I have some interviews the week after, and I'll be out of town though. So this might be the only one in June. So once I'm done with like the summit interviews, which July I still have some more, but hopefully I'll at least be able to do one of these in July, and then maybe again that's my goal, to try to do at least one of these a month. But sometimes again with the thyroid summit, it really has been more challenging. But again, hopefully at least you'll see me in July one time, and from that point after at least once or twice a month on most months. But and again, hope I will see some of you at the boot camp next week. The week of June 10th, thyroidbootcamp2024.com. And yeah, it's going to be a smaller group. So, which is good, because the challenge, when I do like the live challenges that are free, again, it's free, but we get hundreds of people, and which is fun. Don't get me wrong, it's fun doing it, but it's just I wanted something different, just like a more intimate group, and not just not having like hundreds, like five. We had about 600 people, I think, register for the last live event. So here, we'll see how many people show. I'm putting a cap of 75, but again, we might get a lot less. That's like just the max. But if we get 25 to 50, again, that's still, to me, I'm fine keeping the numbers low. So anyway, thank you again for tuning in. Hope everybody has a great rest of your Friday and a wonderful weekend ahead, and catch everybody soon. All right. Take care, everyone.